muscles. Most women have heard of these muscles, but not a lot know how to exercise them correctly and strengthen them. So let's take a look at the pelvis to understand where these muscles are located and what they do. So the pelvis is two halves, joined in the center there at the pubic bone and around the back at our sacroiliac joints. If we look here, we have the hip pointer bones and the pubic bone at the front. If we were to lay you on your back, you can see the openings for the vagina and the anus, and all this red area is pelvic floor muscle. So the pelvis has a hole in the bottom of it, which is where the babies come out of. So these pelvic floor muscles form the base of that pelvis and help to support the pelvic organs, which are the bladder, the uterus, and the bowel. As well as supporting the pelvic organs, the pelvic floor muscles also wrap around the openings of the vagina and the anus, as well as the urethra. So these muscles have two roles. They have a closing role and they have a lifting role. And it's important when we're exercising these muscles that we do both components to that contraction. So like what your mouth does when you suck on a thick shake straw, your lips purse around the straw first and then they draw in. This is what needs to happen around the openings at the front and the back to effectively contract the pelvic floor muscles. We don't just want to clench and we don't just want to lift. We want a combination of that closing and drawing in. So make sure when you're trying to exercise and feel your pelvic floor muscles that you're visualizing that closing and that drawing in action. Now, a lot of people, when their muscles are weak or they haven't been exercising them regularly, not quite sure what you're doing. And that's where having a feel can be really helpful. So in the shower is a great time. You can use 1 or 2 fingers to just feel that sense of the muscles tightening and drawing in around your fingers. Be careful that you're not trying too hard and holding the breath. We don't want to hold the breath because that builds up abdominal pressure and can push down on the pelvic organs, weakening the pelvic floor. When we're engaging our pelvic floor muscles, we want to make sure we can maintain nice relaxed breathing. We want to make sure no other muscles are working. So we don't want our inside thighs or our backside muscles to be tightening as well. It's natural to feel a very slight drawing in the lower area of the tummy, around between the hip bones, just above the pubic bone, but it should be very subtle. You shouldn't feel like your whole tummy is being pulled in and being restricted with your breathing. Now, how often and how many of these exercises you should do is quite individual depending on where your level of strength is at the moment. If you have any issues with incontinence or prolapse, I really recommend going to see a women's health physio for an assessment so they can give you an individualized program. For general maintenance though, you can try holding these muscles as strongly as you can without holding your breath for 10 seconds. Have a little rest and do 10 of those in a row. Try and follow it up with 10 quick squeezes where you engage quickly and then relax. And try and do that once or twice a day to just maintain that level of strength that you have there. If you're wanting to try and gain more strength, you might need to do that more regularly. But like I said, please go and see a women's health physiotherapist if you have any questions. So don't forget, they're really important muscles. They're important for your sexual satisfaction. They're important for keeping you continent, and they're important for preventing prolapse. So when we're exercising, we often talk about engaging our pelvic floor, and this needs to be related to how hard the task is. If it's a very gentle task, then the muscles will engage gently. If it's a more strenuous task, they'll need to engage at a higher level. I hope that helps. If you have any questions though, please get in touch and I'll try and help you out.